When we start working with a child, we have in our intake paperwork some screening questions related to airway. We are asking questions like, how is your child's sleep quality? Are they a snorer? Are they pocketing food or gagging a lot when they're eating? Did they ever have speech therapy or maybe some tongue and lip ties? Why are we asking these questions if our job is to look at toileting success, helping your child through constipation, poop and pee leaks, nighttime bedwetting? Why are we asking questions related to airway and mouth and tongue if we're focused on toileting? I would love to talk about that today because it's a really big topic. Let's jump in. Hi, my name is Dr. Caitlin Keller, and I am the owner and lead physical therapist at Unconstipated Kids. And here at Unconstipated Kids, our mission is to help kids move through and graduate from the challenges related to toileting struggles. So things like constipation, nighttime bedwetting, belly pain, reflux for infants, any kind of challenges related to the gut and toileting, keeping their underwear clean and dry. I hope that today's video pushes you into the right direction to get a great jump start and to move towards full resolution for your child from the challenges they're experiencing. It can be a little confusing why we're talking about airway health when we're here to work on your child's toileting goals. And there's a couple of really big reasons why we screen and treat and look at airway health. Sometimes we're doing it in our office within our work together, and sometimes we're referring out because maybe you need a little bit more support or your child needs a little bit more support. Maybe the magnitude is beyond our scope. And we have lots of myofunctional therapists that we refer to and work with, speech therapists, chiropractors. There are many different providers that have done extra continuing education to work in this area. And so we're absolutely asking for help when we need it. But let's talk about the why first. So why are we asking these questions? There are a couple of big reasons. The first thing I want to bring you to your attention is we're going to have to step outside this world of kids and go into the birth world for a second. In the birth world, there is this idea that a mom who is birthing, if she can relax her jaw and relax the muscles through her neck and jaw, then we get better descent of the baby. The muscles surrounding the pelvis and the pelvic floor relax. Why is that? There's a couple of really intricate neurological reasons. There's some theories that maybe have not had some literature back it up yet. But the idea is that when the muscles of one of these areas, either the jaw or the pelvic floor, are contracted and tight and tense, the other area follows suit and mimics that contraction. And so the idea that we want to help your child toilet better. We want them to be able to relax their pelvic floor, to open the holes of the anus and the urethral opening, to allow poop and pee to come out. If we want that to happen, we need pelvic floor relaxation. Then that means we also need relaxation surrounding the jaw, the mouth, and the airway. And so when there are malalignment challenges, when there's fascial tension, when there's ties that haven't been addressed, when the coordination of the tongue and the mouth movement isn't where it needs to be healthy, sometimes that can lead to clenching, tension to accommodate for those things, and that then leads to pelvic floor tension. And so we want to make sure that that is not a huge area that's contributing to your child's toileting challenges. We want to make sure that they can fully relax and move their pelvic floor. So that's one perspective. The second perspective is related more so to sleep and bedwetting. And so when a child is struggling to get air into their lungs to oxygenate their body because of maybe tongue posturing or the tethered oral ties or maybe just the malalignment of the jaw, when one of those things is blocking their ability to get a sufficient amount of oxygen into their body, the brain is really smart and says, well, we have to keep our body alive. What are we going to do about that with the limited amount of oxygen that is coming into the body? And so the brain says, well, we open up the arteries. We allow more oxygenated blood to reach the body so that even though the oxygenation level is not where it needs to be, that the increase of volume of blood to the body allows more oxygen to be delivered. So the problem with that, though, is that it works. The brain tells the arteries to open up. That allows more blood to be delivered. But the brain can't tell just the arteries to open up. The brain tells smooth muscle to relax. And when the brain tells smooth muscle to relax, smooth muscle includes a couple of different things, one of which being arteries, but another thing being related to the bladder. The bladder is made of smooth muscle. And so when we get this limited oxygen at night because of airway dysfunction, the brain responds with, we need more oxygen, open up smooth muscle. Well, that's when you can get a connection to nighttime bedwetting. That's not the case for everybody, and there's a couple of precursor things that need to be met before we really look into that. Daytime toileting habits need to be great. There needs to be no presence of constipation, because if those things are present, we need to work on those things first. But that concept of the brain causing smooth muscle relaxation is the Bohr effect, BOHR. And so that can be one component that we're looking at. The other thing that I want to talk about is how we coordinate our body. And so if your child has had a history of speech therapy for articulation skills, speech, or maybe some feeding intervention because they can't manage a bolus of food in their mouth, they can't swallow it, they're having difficulty with that. Maybe they had difficulty in infancy with latching or feeding. That can be an indication that there is a discoordination component going on. If they can't coordinate the tongue, mouth, jaw to be able to chew, swallow, but continue to breathe, if they had difficulty with figuring out where to place their tongue and to get coordinated suck swallow during infancy, that could be an indication that their body needs some support with coordination. And that might be related to a couple of different things. Maybe they just need the opportunity to practice. Maybe they need some therapeutic intervention to help support that process. Maybe they have retained primitive reflexes that are dictating how they can use their body, because if a primitive reflex is retained, meaning still present and controlling their movement, that primitive reflex makes it so that your child can't autonomously move their body. They're not in charge of their movements fully and completely because the primitive reflex is still controlling it. A brief summary about primitive reflexes is in infancy, we have the rooting reflex. If I were to stroke an infant's cheek, they turn to find milk. That's a survival mechanism. It's a primitive reflex to help survival. But as an adult, we don't have that anymore because it is integrated at some point during toddlerhood. We hope that all of our primitive reflexes are integrated, which means they go away, they no longer dominate our movement patterns. But if a child's primitive reflex related to, we typically screen for 5 in clinic, if one of those still remain, those primitive reflexes can dominate how a child is coordinating and in control of their body, which can then overflow to how do they do this task of toileting, because toileting is pretty complex. Toileting is how do I relax my body while relaxing my pelvic floor, while generating pressure, while also receiving the information about what am I sensing, what am I feeling, and how do I respond to that. And so there's a lot that goes into toileting, and it's a fairly complex skill. And so we want your child to be able to volitionally control their body without any kind of disturbances. And so that's why we'll look at primitive reflexes. This is a lot of information. This is a lot about the connection of airway and pelvis, pelvic health, and toileting habits. We want to make it as simple as possible for you to understand. So we don't expect you to then go and treat your child's intraoral dysfunction that they may have, but we want to bring to light to you that this is why we're screening for airway and looking at the connection, because there are some really big connections between airway health, mouth health, tongue health, tethered oral tissue ties, tethered oral tissue, and then also toileting presentation, challenges, bedwetting, leaks, and constipation. I hope that brings some clarity to you, and we're looking forward to supporting you. Thanks so much for being with us today. I hope that today's video was helpful. As always, we have services and resources for you, so reach out to us. We would love to help you start to find resolution for your child from their toileting challenges.